c'est Christine Saint-Ville. Moi, un psychologue. Réellement pas bon, so m'a parler anglais. Alright, so, excuse me. What I want people to start beginning to think about mental health is mental wellness. We think about mental illness and people being crazy, but all of us have mental health. And we all need to be contributing to our own mental health. As Haitians, we often put others in front of us, and it's important that we fill up our tank. If I want to drive from here to New York, I gotta stop for gas, right? So I have to do self-care. I have to put into myself. And as Haitians, we have a lot of things in our community that promote self-care. Whether it's TIC, whether it's going to church, whether it's talking to friends, whether it's being around family. But one thing we don't talk about is therapy. People think that therapy is for crazy people, but it is not. It is a conversation that you have with your therapist about things that are going on in your life. A lot of times people come to therapy after a crisis, and while that is okay, you can, just like you go to your PCP, you can go to your therapist and have a conversation. The great thing about therapy is it's confidential. We can't tell anybody anything you say unless you report wanting to harm yourself, wanting to harm others, child abuse or elderly abuse. So you can tell us whatever you want to talk about, and I can't even tell it to my fellow therapists. So it's a safe place for you to come and talk about what's going on with you. Now, in terms of how do we get therapy, Rebati Santé Mental was created after the earthquake because we realized there wasn't a place that people can go to seek mental health. And we are now creating a directory where people can look at therapists and psychiatrists in their local community and see who's there so that they can see where they can get treatment. And a lot of therapists are now taking insurance and will offer sliding fee scale for people who need therapy but cannot afford it. Rebati Santé Mental has partnered with Coupe Quality Clinic in Pompano to offer low-cost therapy to individuals in the community. The medical clinic has Creole, English, and Spanish, so you can get therapy in all three languages. And so we just wanted to come out and give you some information. We also are having a mental health fair May 20th, and you can follow us on Rebati Santé Mental on Instagram. Any questions? Symptoms of depression are difficulty sleeping, sleeping too much or sleeping too little, feeling like I can't concentrate, I can't focus, difficulty eating, I'm eating too much or too little. I feel like I can't be the best self. The things that I was interested in before, I don't feel like doing. I just feel like staying home. I feel like isolating myself from others. The thing is, sometimes we do feel sad, but when it starts to interrupt your day, when it starts to interrupt your routine, that's when it becomes problematic. And that's when you need to go see somebody to talk about, okay, these are the barriers that are facing me, how can I address them, and what things that I can do.
Is there like any resources where we can go to find like Haitian therapists? Just because I'm sure we could all agree, being raised by Haitian parents can be a little traumatizing, and it's different from most places.
Yeah. So on Rebati Santé Mental RSM.org, we have a directory where you just put in your zip code and it will pull up all the Haitian therapists that we have gathered. We're still gathering them, but for Miami and Broward, we have the most amount in our directory to look for Haitian therapists.
Are there little things that we can do on a daily or weekly basis that can help us determine if we are mentally stable or we probably need to get help?
I think there are different things to take care of yourself, and when you realize those different things aren't helping anymore, that's when you know it's a problem. So if I'm going on walks, if I'm going to the gym, if I'm going to hang out with friends and I still don't feel like I'm myself, that's when you know, okay, I may need some help. And again, you don't need to be in full crisis to go see a therapist. It's just, my parents are stressing me out, I need to figure out how to be a child, to take care of my children. How do I do that? It's a place for you to unload and for us to hold space for you.
What's the best way to convince somebody of Haitian descent that seeing a therapist will benefit them?
That's a good question. A lot of the time it's normalizing it, and I say start with yourself. You go do the therapy, and when people start seeing the changes in you, they're like, what did you do? And sometimes it's even going with them to the first appointment, because the fear is that this person's going to judge me. The fear is that I don't know what this is. So I'll go with you to the first appointment. Let's go together. And that's oftentimes helpful. Yeah.
And also,
we actually have one in Haiti, but not one here. A 988 is the general one here, and on our Instagram we have the hotline in Haiti, but on our website, if you contact any of the therapists, we will be able to talk to you through. Yeah. Good question. Any other questions?
how can we find an affordable therapist?
Okay, so you can always ask any Haitian therapist. Well, if you have insurance, use that. You're already paying for it. If not, ask for a sliding fee scale. And again, with Coupe Quality Clinic, we offer therapy for $50 to $75. That's the lowest you're gonna find in the community, but that's one thing that we're giving to the community. A lot of psychologists give their time in a day to help our people.
Ça veut dire qu'on allait à l'hôpital longtemps, qu'on n'aurait pas gagné. Même que longtemps, je ne me senti comme ça, même quelques semaines, comme si je me sentais loin. Je me sentais pas intéressé, comme si je n'avais pas de moi. Je me connecté à mon cap, je suis capable de faire. Je me sens moralement au Jamba. Moralement au Jamba.
DJ photograph. DJ.
Okay. And I think someone's going to translate for people. It's important to understand that depression can come in waves. You may not just be depressed for one time in your life. It may come in waves. You may feel good one week, and the next week you may feel depressed. Now, it's important to do the therapy part, but psychiatry is just as important. To take, there are SSRIs, there are NSRIs that you talk to a psychiatrist about that will help with the daily feelings of feeling low. But the things that you can do is talk to somebody who you feel that you connect with in terms of a therapist, so that you can talk about the things that are going on. Because if we want to be real, there's a lot of things in our community, even watching what's going on in country, that traumatizes us over here, and we don't know how to deal with it. So we have to recognize that all this stress can play a role on our mental health and can cause us to be depressed.
Encore une fois, Dr. Daniela Lamont.
Thank you. Hello everyone, I'm Dr. Lamour. I'm very happy to be here. I'm also Miss Haiti. Thank you so much. Yes, so I'm going to talk about women health emergencies because I do work in the emergency room, and last week was Black Maternal Health Week, so I decided to do a board to present on it, and I thought it would still be fitting because how many of you guys know we need women in this world? Without women, we would not be here. So I wanted to talk about some of the common things that women come to the ER for and things to look out for. So the first thing, the number one cause of death in women is heart attacks, heart disease, right? So I wanted to explain very quickly what happens when you have a heart attack. So basically you have plaque buildup, it's right here. This is your artery. If you have plaque buildup from the food you're eating, cholesterol, it comes into the arteries and the veins. So sometimes it ruptures, meaning it breaks. When it breaks, the body is going to try to heal itself by forming a clot. When it forms that clot, it completely blocks the artery and there's no room for blood flow. When there's no blood flow, you have cell death, and then that's when you have death of the heart, and that's what's a heart attack. A lot of times things to look out for is like chest pain, difficulty breathing, arm pain, is going to your jaw, anything like regarding the chest. Come to the emergency room. It's not worth, not checking it, because a lot of times it affects women more than men, and a lot of times we can save you if you come in a timely manner. So biggest things, chest pain. If you have high cholesterol, come to the ER. Next thing, stroke. Stroke affects women way more than it affects men, okay? And stroke is very, very common, as you know. I'm pretty sure, by a show of hands, who knows someone who had a stroke in their life? So, exactly, so it's very, very common. So you have to know the signs of a stroke, okay? So we have a mnemonic called Be Fast. The first one is balance. If you see someone off balance, they can't walk right, that's a bad sign. If they normally can ambulate straight and now they're leaning to one side, something is wrong in the brain. Another thing, if they're having double vision out of nowhere, not normal. If someone's coming to you saying, I can't see, all of a sudden I see black, I'm seeing double. Bring them to the ER, okay? Another thing is the facial droop. Out of nowhere you can see their face starts to hang down. Not normal. Sometimes that could be caused by a virus called from Bell's palsy, but don't think it's that. Come to the ER, get checked. Another thing that you have to be aware of is that it could affect your arms, right? So if you have sudden weakness in the arm, come to the ER, because it could be in the brain, right, causing that. If your speech is off, like they're slurring their speech, if they're trying to talk but if the words are not coming out, that's called aphasia. Come to the ER. It's not worth it, because if you come when things, like when you notice the symptoms quickly, we can give you a life-saving medication. If you say, no, I'm going to sleep it off and see if I get better, worst thing you could do, because we could only give you this medication within 4.5 hours. It's called TPA. If you're out of that window, you're out of that window. We can't treat you. So if you see any signs of things like that, just come as soon as possible. It's better to be nothing than to be something and then it's too late to be treated. And then the time frame, like that's the T. Come quickly, call 911. These are things that could really save your life if you come in a timely manner. Another thing, a lot of women have vaginal bleeding. Out of nowhere, they just come in, I'm bleeding, it's not like my periods, it's longer than usual. Things like that. The biggest cause could be like fibroids. Like there's a lot of reasons why you would bleed. If you're on like hormones, like birth control, it can cause you to have irregular bleeding. It's not an emergency unless you're bleeding too much, meaning using more than 1 pad an hour. That's too much blood. But if you're bleeding, let's say 2 pads a day, you could always make an appointment with your OBGYN. But if it's very fast, the problem is you could be losing too much blood and you might require a blood transfusion. Vaginal bleeding in pregnancy, this is a big one, right? So I don't know if any of you guys knew anyone that had some bleeding in pregnancy, but the biggest concern is that you might be losing the baby. The mother is like, am I losing my baby, right? But what we want to know in the ER is, where is that baby? So if you can see here, I know the pictures are small, but there are several places the embryo can implant, meaning several places where the baby can be that is abnormal. We want it to be in the uterus because that's where it can grow fully. If it is in the lining, if it is in the fallopian tube, in the ovary, that is bad. That is called an ectopic pregnancy, and that could be deadly because it will burst, right? Because it does not belong there. It's going to continue to grow, and it could burst into your abdomen, and that could cause a lot of problems, including internal bleeding. You're going to need surgery. So whenever you're pregnant, have bleeding complication, and you don't know where the baby is, let's say you didn't have an ultrasound yet, come to the ER, because things like that, we need to give you a medication to medically abort the baby because it cannot live there, because it will hurt you in the end, because it has to be in the uterus. Another thing, when people have breast complaints, they always think it's breast cancer, right? That's the biggest concern. Do I have breast cancer? Unfortunately, we don't diagnose breast cancer in the ED. Like, we can tell if it is, but you ultimately need a biopsy. But other things that people can see on their breast is like, it's called a cellulitis, basically just redness, a deep skin infection. So not everything is cancer. Sometimes it's just a simple infection that you need antibiotics for. Also, you can have like an abscess in the breast. Like, that's very common. That needs to be drained by a surgeon. That's another reason to come to the ED. So don't think all masses are cancer. All masses do need to be observed and need to be managed, but we just need to know what it is. Don't think the worst. Don't go on Dr. Google, because you're going to think you have cancer for everything, okay? Another thing, sexual health. Everyone comes in, they have vaginal discharge. If you're having unprotected sex, which is not recommended, you're always at risk for STDs. So just be mindful if you notice new discharge, new odors, things like that. Come to the ER. We could always check you for the common STDs. Pelvic pain, right? So that's another thing. So if you know a woman with ovarian cysts, basically we have 2 ovaries, and sometimes we have cysts in our ovaries, and a lot of times it's normal, it's benign, it doesn't bother you. But if you have a cyst that grows too big, as you can see here, you are at risk for something called ovarian torsion, meaning the cyst is so big it's going to cause the ovary to twist on itself. When it twists on itself, that compromises the blood flow, and that is an emergency, okay? So let's say you have abdominal pain, we call it pelvic pain, and you know you have ovarian cysts, come to the ER, because it's all of a matter of an ultrasound, we can check to see if you have this condition, okay? Another thing I want to talk about is intimate partner violence. We get that a lot, that women getting abused, raped, sexually assaulted. That's another thing that's very big, and it's one of my worst complaints in the emergency department, but we have to be aware of it. If you know anyone suffering with issues with their relationships, please, please, please speak up, because it causes death in women, okay? And we want to protect our women. Yes, question.
For the amazing presentation. So my question for you is, what are the major risk factors for stroke and heart attack? Qu'est-ce qui can cause problème attack avec stroke?
Okay. So the biggest risk factors is what everyone usually have. Can you tell me a condition that everyone usually has?
Diabetes.
Diabetes. What else?
Hypertension.
Hypertension. Who says hypertension? Biggest risk factor, because hypertension could cause not only, there's two types of strokes. There's an ischemic stroke, which is caused by a blood clot, and then there's a hemorrhagic stroke, which is a bleed in the brain. If you have a bleed in the brain, it is most commonly caused by uncontrolled hypertension. Blood pressure is in the 200s. That, is unacceptable. If you know your blood pressure is that high, we need to get better management, because you can have a hemorrhagic stroke. And strokes are, they not only do they cause death, but if you do live, you have permanent disabilities a lot of the time. So we want to prevent that by controlling our blood pressure. High cholesterol is another one. I mean, it plagues us all because of the food we eat. So we have to control what we eat, because it'll control our pressure, our cholesterol, and our sugar, which are the three main causes of stroke.
Ok, nous avons une dernière question avant que nous changions.
Hi, so I see that you're Miss Haiti International. Can you tell us how you're giving back to the community?
She is.
Okay. Thank you. But also, this is my cousin, by the way. So she wants me to talk about, so I actually have a mentorship program that I just started. It's called Mentor Me Galore. The whole purpose behind this mentorship program is to get more diverse physicians in the work field, because we only make up 2% of physicians in America as a black woman. So we need to increase that statistic. So my goal is to expose the medical field to high school students, college students, and hopefully medical students if they need advice along the way. And I'm giving out 3 scholarships, $1,000 each, to a high school senior, a college student, and a medical student, in hopes to alleviate some of the burden that comes with the medical field, because it is very expensive, it is very stressful. But my goal is to be a bridge, a one-stop shop to the next generation, to help them get there totally for free. I'm very available. Contact me on social media and I'll answer every question. I've been doing it for years. I just started the organization, and I just hope to see more physicians that look like me in the medical field.
How can we find out more information?